Hey everyone, welcome back. I'm Dr. Josh Oh from I.KNOW.U Plastic Surgery Clinic in Busan, South Korea. In our previous episodes, we discussed who might need a lip lift and common concerns about the surgery. Today, let's talk about the actual design and planning process for lip lift surgery. In lip lift surgery, it is very important to design the incision to follow the innate contours of the nasal base and philtrum. Everyone has natural grooves under the nose, and these boundaries are formed as our facial structures are developed even before we're born. Our nostrils and the center of the nose and both sides of the philtrum all originate from different parts. They come together and fuse in the middle, forming the current structure of the nose and philtrum. The shape of these grooves is different for each individual, but respecting these natural lines and not disturbing them is crucial for a natural outcome. When the design is done well, as you can see in this selfie photo, the scars are so discreet that others cannot tell anything has been done. The incision should blend seamlessly with the natural shadows under the nose. That being said, there is another important aspect to consider. Take a look at this photo. If you examine the base of the nose closely, you will notice a small bump near the boundary from the nostrils to the philtrum. This structure is called nostril seal, and some people have it well developed while others barely have it. For those with a well-developed nostril seal, it's crucial to preserve this structure. Sometimes an internal or endonasal incision is made inside the nostrils to hide the scar, but I think this can damage the important anatomical structure of the nostril seal. If this structure is damaged, it can result in an unnatural appearance with a flattened base of the nostrils, making the nose look artificial. Additionally, when the nasal discharge flows, it won't pull at the base of the nostrils as it's supposed to be, but will instead flow directly out. When it comes to incision patterns, I personally prefer the bullhorn design. The incision line is designed to extend from one end of the shadow under the nose to the other. It resembles a wavy pattern or mustache shape. However, if the incision extends too far outward, the scar may become easily noticeable to others. Therefore, it is important to keep the incision within the shadow range under the nose to effectively hide the scar. The gull-wing design, which involves an incision directly along the upper lip line, tends to leave more noticeable scars, so I don't use it. Similarly, the Italian design, which involves a partial incision under the nostrils only, doesn't provide sufficient lift and places too much tension on the skin incisions, often resulting in poor scarring. Therefore, I don't use this design either. During consultations, many patients are curious about how much we reduce the philtrum length. Often, when I suggest reducing it by 5 millimeters, they ask if 6 millimeters is possible. And if I suggest 6 millimeters, they ask for 7 millimeters. And it kind of goes on and on. However, I believe it's not about how much we cut off, but rather how much length remains after the surgery. Our goal is to achieve the ideal 1:2 ratio as I mentioned earlier. Typically, we reduce the philtrum length by about 25%. Which usually means removing around 5 to 7 millimeters. But since the length can increase by about 1 millimeter over time, I try not to be too conservative with the amount removed. But for patients who already have enough tooth show or who have a narrow nasal base compared to the width of the lip or who have a steep upper lip angle already, we must be more conservative with the reduction amount. Once the skin is removed, we cannot put it back, so we must avoid being too ambitious. Over-resection can result in an unnatural appearance, which might not be well received by other people. Before the surgery, I sit with the patient and design the new philtrum length, showing them a simple preview of the post-surgery look. We discuss how much of the upper teeth will be visible with the reduced philtrum length, and together we finalize the design. This procedure is usually done under local anesthesia. Some patients may want to have this type of procedure under twilight or sedative anesthesia. The total surgery time usually takes about 40 minutes. There is hardly any pain or discomfort. Even though the procedure is done under local anesthesia and you remain conscious, I will guide you step by step, explaining what is happening so there is no need to feel anxious. Many patients who are very nervous and scared when they first enter the operating room often find that there is no significant discomfort once the surgery begins. After about 15 to 20 minutes, some patients even fall asleep and start snoring. That's how comfortable it is. All I need to do is to perform the surgery meticulously. In order to make the surgical incisions heal as swiftly as possible, immediately after surgery, I use PDRN regenerative injections, exosomes, and skin Botox around and inside the incision area. That's all for today's episode on lip surgery design and planning. In future videos, we'll cover more topics like post-surgery care and combining lip lift with other surgical procedures. At I.KNOW.U Plastic Surgery Clinic, we're here to help you with friendly and knowledgeable staff members, modern and comfortable facilities, and our healing box that includes all post-surgery essentials like scar gel ointment, ice pack gauze, portable cleansing wipes, cotton swabs, and even anti-swelling pumpkin tea and more. We even offer post-op shampoo services and post-op scar laser treatments based on the philosophy that we provide continuous and comprehensive care with a personal touch. This is why our clinic is named I.KNOW.U. Don't forget to subscribe and hit the notification bell so you don't miss it. For more specific inquiries, check the customer service link in the description box. Thank you everyone for watching. See you next time.